Hi, this is Dr. Mukarram, Pulmonologist from Pratima Hospital, Kachiguda. On the World TB Day, 24th March, on this day, Robert Koch had discovered this organism called Mycobacterium tuberculosis, cause of tuberculosis, and he had discovered it and he had presented it to the world. So we celebrate this day so that we educate the people about this deadly disease, and we try to educate so that we prevent this disease and we treat this disease to the complete cure. So what happens in tuberculosis? Tuberculosis is a disease primarily which affects the lungs, as well as it can affect the lymph nodes, it can affect the skeletal system like the joints, the bones, the spine, and it can affect the abdomen as well, and it can cause infection in the brain as well. So it can affect any part of the body. Primarily lungs is the main concern, because from lungs this disease can spread to the other person as well, because it is a communicable disease. So we have to be very careful and we have to monitor ourselves. Like if we have cough, fever more than 2 weeks, we need to take a chest x-ray, or we need to take some sputum examinations, and we need to consult our doctor immediately. Usually tuberculosis affects the lungs. In 2021 data, the 56% of the tuberculosis patients were men, 32% were women, and rest 11% were children. So we have major challenges here. We need to accept this disease, we need to identify the disease, and we have to treat the disease accordingly. We have a treatment schedule of 6 months of duration, which is a fixed schedule by the WHO, which is given free of cost from the DOTS, as well as we have medicines in the private sector as well. So what are the major challenges? A lot of people, when they start feeling better after 1 or 2 months of treatment, usually they stop their treatment and they think they have recovered. But the recovery phase is only after 6 months of treatment, and after seeing the patient, examining the patient, and we have to declare the patient as cured. If they stop the treatment in between, if they develop the disease in the later stages, they might develop drug resistance. Drug resistance there is a rise in the drug resistance cases, and once a patient becomes drug resistant, the treatment goes up to 2 years of cure time, and there is a huge mortality in such cases as well. And especially in India, we have underreporting. Nearly 24% of the people in India have underreported their tuberculosis. There are worldwide 10.6 million cases which have been diagnosed, and in 2021, which is a 4.5% rise from 2022. In that, 28% cases are still in India. So that is a huge burden for our population. So our aim is to diagnose the disease, treat the disease, and cure the disease, because it is a preventable and a curable disease as well. So there is a call from the ministry as well, and there is a caption of this year which have been communicated also: TB Harega, Desh Jeetega campaign, which is going on everywhere. So our aim is to promote this campaign, and we have to end the TB as soon as possible. Thank you.